All right, no breakfast in my teeth. Ooh, we're recording. All right, take two. No, I'm just joking. I have no idea how to do that. I hardly figured this thing out. Okay. Just pretend that didn't happen. Good morning, everyone. My name is Rochelle. I'm going to be talking to you about strategic family therapy. I have some friends down there. We have Stephanie, Megan, Bryce, Brianna, and Lindsay, and hopefully they're standing in the order that we practice. Otherwise, I look like a big fool. Strategic family therapy can be a little bit complicated. So if you have any questions, just raise your hand and one of my darling friends down there will shut me up, pause me, and answer your questions for you. All right, so strategic family therapy was developed by Jay Haley, who worked with Milton Erickson. He was greatly influenced by Salvador Minuchin, who was the one who introduced and developed structural family therapy. And so between the two, you'll see some similarities, some influence there, but there are a lot of differences as well. He was also influenced greatly by Gregory Bateson. He studied cybernetics, which basically is the communication between within a machine or between machines, and he connected that to how humans communicate with each other. And so Jay Haley was influenced by that, and his strategic outlook on family therapy was influenced by Gregory Bateson's cybernetic connection to social science. Strategic family therapy has three pillars that it stands on. The first one is that there's less insight and more process. So we're focusing on the process of communication a lot, not so much on gaining insight into problems or issues. It's very therapist directed. The therapist is front and center. The therapist is giving directions. The therapist takes responsibility for giving out tasks that will work, modifying tasks that don't work, and for influencing the family. So it's the therapist's job to really have influence over the family. And then the third pillar is it's a focus on systemic interaction patterns. So it's a systemic therapy. It works on the underlying system, part of systems theory in a way. Underlying systems of the family, and it would never just include one or two members of the family. It would always include the entire system. Let's say a mother who comes and says, the problem is that me and my daughter are fighting often. We wouldn't just take the mother and the daughter and look at them in a vacuum. We would in strategic family therapy, we would invite the father in and say, well, what's dad doing while mom and daughter are fighting? Where's the brother? Where's the other sister? It's a very systemic, overarching look at the family system. Strategic family therapy looks at the process, like we just said, of communication and how it affects the overall strategy of getting the family to improve. So we're looking at the process and how we can use the process or change that process to get the family to improve the way they communicate and interact with each other and function. You're giving systemic directives, so the tasks that you're giving the family to do affect the system, affect the overall interactions that they have, and it interrupts problematic behavior, which is the goal of strategic families, to get the family unstuck. I'm using the word unstuck because it makes the most sense to me, but basically a family kind of gets stuck in a pattern or a way of behaving or a communication pattern, and the point of the systemic directives is to get them unstuck. Now, Haley referred to those as feedback loops, and that's one of the things that we're looking for during strategic family therapy is how the family talks to each other, communicates with each other, that kind of keeps them in that rut, or keeps them at their status quo, which would be homeostasis, which a family is always striving for, even sometimes at the risk of preventing positive change. So they're constantly, let's say, doing the same thing or saying the same things or communicating the same ways, even though it's preventing them from having positive relationships, or even though it's constantly making the same mistake over and over again. So you're looking for those feedback loops, those repetitive behaviors, those repetitive communication patterns that are keeping the family stuck. And what we want to do is kind of, through strategic family therapy, poke a hole in that, kind of interrupt that a little bit, to kind of get the family unstuck. You're looking for paradoxical injunctions that create double binds. So they're kind of like rules of the family that are a lose-lose situation. So for example, the mom says, I want you to be honest with me. I want you to be honest with me. But then when the child is honest, screams and disciplines and shouts at the child. So the child has, it's a lose-lose situation. You're looking for incongruous hierarchy. People who have power in certain situations in which they shouldn't have influence or power. For example, a child who, has too much influence in a certain situation that, is not healthy. And then the way that we're going to, like I said earlier, kind of poke a hole to disrupt the feedback loops that are keeping the family in a negative pattern would either be a first order change, which you're looking to change the behavior itself. So it's going to be you're going to give them a directive that's going to interrupt the behavior, or it would be a second order change. It would be a task or a directive that you would give them that would interrupt the rule that kind of allows the behavior to continue. So the ultimate goal of systemic family therapy is to give the family tools in the form of systemic directives to interrupt the way they behave or respond and communicate with one another, to create more healthy norms in the family. Now, the process was broken down by another lecturer that I saw, and I liked the way that she broke it down because it helped me understand how systemic family therapy kind of flows. So there's a social stage, which we actually spoke about a lot in this class with Professor Behan, which is kind of like small talk, just getting to know the person in front of you. It's building rapport, but more so than that, just really understanding who you're talking to. What do you do? What do you like? What's your job? And that's really the first stage that Haley speaks about, which is the social stage. The next is the problem stage. You're asking the family about the problem. There's the interaction stage. You're asking the family how they interact with each other, what their interaction styles are like, and you're asking them to demonstrate that for you even at times. And sometimes that happens naturally, where the family, you get to see that, how the family interacts with each other, and sometimes you ask them to demonstrate it for you. There's goal setting. You're trying to figure out, what our goals are, what are we trying to accomplish. Then there's the task. So those are the systemic directives, the homework that you're giving them. Go home, do X, Y, and Z. And then there's termination. Termination is happening pretty much from the beginning, and there's a clear beginning and end to the therapy. Some of the ways that the therapist would, interact with the clients, with the family, are the following. There's strategic positioning, which almost seems counterintuitive to therapy and especially to social workers. Strategic positioning would be saying or acting in a way to elicit a specific response. So it could almost, when you're watching it, it could almost look manipulative, but you're actually doing it to elicit motivation or, some kind of response that will be helpful to the therapy, will be helpful to the family when, in terms of improving. So for example, you might say, oh, that's a big problem you guys have. I don't know that I can help you. What you're trying to get the family to say is, no. I think we can keep moving on with this therapy. I think if we try a little harder next week. So you're kind of saying things to motivate the family. And again, although this seems counterintuitive, it works a lot for families who are very resistant to therapy, or therapy hasn't been working very well for them in the past. Also, you're giving paradoxical directives. Another thing that we already, discussed briefly in this class with Professor Behan, you're prescribing the problematic symptom. Now, just as a warning, you want to be very, very careful with this, because if you're working with suicidal patients or severely mental ill patients, this could be very dangerous. But when used properly and researched properly, you can understand that when you prescribe a problematic symptom, but in a new context, you're highlighting the dysfunction to the family. They're able to see it from this other angle, from this different perspective, and suddenly there's, this desire to change or to move away from that problematic behavior. So the example that Professor Behan gave a few weeks ago was telling a couple who's, having a lot of marital disharmony to stand in the bathtub on Tuesdays at 7:30. So specific time, specific place, strange location, and to fight. This is your fighting time from 7:30 till 8:00 p.m. on every Tuesday. This is when you fight, standing fully clothed in the bathtub. So you're prescribing the symptom, but in this new strange context. And that's another way of kind of getting people unstuck, because you're switching up the context. They're able to see it in a different way. Another example that someone gave that I heard was a child who was refusing to do their homework, but he was kind of older. I think he was in 8th grade. And so the strategic family therapist told the mom that every time she has to tell the kid to do her homework, to suck her thumb. So you're kind of symbolizing to the child that he's behaving like a baby, but also you're symbolizing to the mother that the fact that she has to remind her 8th grader to do his homework 20 times is also, treating him in a bit of an immature way. So again, you're not, creating these big disturbances in the behavior. You're doing these small things, these little small disturbances that get the family to see their behavior in a different light. And that brings us to relabeling or reframing, which also does the same thing, looking at the problem from a different perspective. You're targeting a small sequence to change. So the therapist didn't say, okay, don't tell him to do his homework anymore. We're going to completely change the behavior. No, suck your thumb when you tell him to change his behavior. Tweaking the way the family communicates, tweaking these sequences, these patterns of behavior, these patterns of communication, and by that shifting or interrupting the problematic behavior. And then there's the pretend technique, which is fake it till you make it. So even if you're not feeling it, even if it doesn't, really mean something to you, just doing it by route and then seeing what happens further down the line. So the 5 basic steps to strategic family therapy are identifying solvable problems. So small, very easily identifiable problems. Every time I go to the department store, my child screams. That would be a identifiable, solvable problem. Then you're going to set a goal. What do we want the goal to be? What do we want the outcome to be? You're going to design interventions. That's where the systemic directives come in. That's where the tasks comes in, the homework. The therapist gets really in there and tells them do X, Y, and Z. And then the next session, when the family comes back, it's very important to examine the responses. Did it work? Did the task work? Did it help? What happened? How did you see the problem? And then therapist needs to kind of ascertain whether or not that was a useful directive, or should we switch it up and do something else? So you're examining the outcome of the therapy. Did it work or did it not? Do we need to switch it up? Did it help? Did it not? And that, in short, is strategic family therapy. If anyone has any questions, I'd love to hear them. I'm just joking. I cannot hear them, but I'm sure that my very friendly friends will help you out with them. And without further ado, I'd like to introduce to you therapist Megan and the BAB family. Thank you so much for listening. Enjoy the role play.